Is lung cancer wedge resection right for me? Imagine having a small spot on your lung that worries you. Wedge resection might be a good option to consider. It's a surgery that removes a tiny, triangle-shaped piece of lung tissue that contains the tumor. This approach is called lung sparing because it keeps most of your lung intact. It's often done using a minimally invasive technique called video-assisted thoracoscopic surgery, which uses small incisions and a camera. This usually takes about 1 to 2 hours and has fewer risks than open surgery. Recovery tends to be quicker, and most people can get back to their normal activities within a couple of weeks. Wedge resection is generally suitable if you have early-stage lung cancer that is small and localized. If the tumor is confined to a small area, removing just that part of the lung can effectively eliminate the cancer while preserving lung function. It's also a good choice if you have other health problems or are older and cannot tolerate more extensive surgery like removing an entire lobe or lung. Sometimes, doctors recommend wedge resection if scans show suspicious nodules or lesions that need removal for diagnosis or to prevent potential health risks. If you have had lung cancer before and develop a new tumor, wedge resection might be an option since it leaves more lung tissue available for future treatments. It can also be used to treat metastatic tumors that have spread to the lungs or certain lung conditions like bullous disease or even rare cases of drug-resistant tuberculosis. One of the main benefits of wedge resection is that it preserves more of your lung capacity. Because less tissue is removed, your lungs can work more normally after surgery, making recovery easier. The risk of death from this surgery is very low, with less than 1% of patients experiencing serious complications. When performed with minimally invasive techniques, the chances of complications like infection or air leaks are also lower. Many patients return to their daily routines within 2 weeks, which is faster than recovery from more extensive surgeries. However, it's important to understand the limitations. Wedge resection is less likely to remove all cancer cells compared to more extensive surgeries like lobectomy, where an entire lobe of the lung is removed. Because of this, the chance of cancer coming back after wedge resection can be higher. Some studies suggest that 5-year survival rates might be lower with wedge resection than with lobectomy, but recent research shows similar survival rates in some cases. Most experts still recommend lobectomy for early-stage lung cancer because it offers a better chance of complete cancer removal. But if you cannot tolerate a lobectomy due to health issues, wedge resection can be a valuable alternative. Like all surgeries, wedge resection carries some risks. These include reactions to anesthesia, bleeding, blood clots, infection, pneumonia, and air leaks from the lung. Rarely, complications can be more serious, but overall, the procedure is quite safe. Most patients are alive and well 1 month after surgery, with a good chance of returning to normal activities. Recovery is usually faster than with larger surgeries. You might experience temporary shortness of breath or need oxygen support for a short time. Swelling in your legs can happen but typically goes away. Your healthcare team will give you specific instructions on activity levels and breathing exercises to help your lungs heal. It's essential to discuss your individual health, tumor size, and personal preferences with your doctor. They can help determine if wedge resection is the best option for you, or if a more extensive surgery might be better. Remember, every person's situation is different. Your medical team will consider your overall health, lung function, and cancer characteristics to recommend the most appropriate treatment. Always seek personalized advice from your healthcare providers to make the best decision for your lung health and future.